And immediately I was saying, well, this isn't the position of the Swedish government, that's for sure. And in my class, I actually posed the Obama versus McCain tax plans and more or less the winners and losers there, and then compared the U.S. rate of taxation to that of the Swedes. And the Swede overall, as a percentage of the GDP overall economy, the tax rate in Sweden is about twice that in the United States. And I thought you articulated it very well in terms of what you get for that. And maybe as a kind of, I think I'm specifically as a libertarian, to be able to rebuttal to that. But if you don't mind kind of articulating the same thing again.
Yes, we pay a high tax, but we pay a progressive tax, the same as you do in America. It's a percentage, and that means that though it is high, it is affordable by everyone. Whereas in America, you pay directly for many of the things that our tax money pays for us. You pay your tuition fees. You pay for your healthcare system directly in a way we do not. We pay our tax money and then we receive our healthcare, our education, the care of our children, etc. for free. The money that we pay in tax is not money that you get ultimately to keep in America. It is not that simple, but you direct it and manage it person by person in a different way.
Return rebuttal.
Well, only that, I mean, that, it's, kind of that it's not money you get to keep. I mean, the fact is, it's a matter of choice whether or not you keep it. In America, we have freedom of choice in what we choose to expend our values, our money, and our, if we find value in. If you don't think the health care is worth the, the cost of it, there's nothing that obligates you to purchase it. If you don't find various other things, that you have the ability to choose what you want to take advantage of. And therefore, I mean, so that's a big part of, freedom. There's also, when you go and socialize a lot of things, as is done in a lot of Europe, there's a notable decrease in quality. For example, in healthcare. Numerous studies have found that, for example, doctors in the United Kingdom and Canada, both with various different forms of socialized medicine, they have much, their doctors see about 50% more patients than American doctors do. And there's a corresponding decrease in the quality of care. Far more women die of breast cancer in the United Kingdom. Far more men die, suffer from prostate cancer. If you have renal failure, you're a lot more likely to get dialysis in America than you are in the United Kingdom or Canada. I mean, so the whole fact is that the profit motive does play a large role, and that when you socialize it, you increase the cost to zero. Therefore, demand shoots through the roof. Supply, there's no increase for the supply, and as a result, quality is. But since everyone has to be seen, quality goes down accordingly.
Anyone else want to respond?
I guess just want to also be kind of a fact check here and maybe set the Swedes up. There's a lot, like with health insurance, which is something I talk about a lot when I teach public policy. The United States spends twice as much than the Swedes on health insurance, and the Swedes live longer. I think you pointed some stats out that I must admit, I'm assuming you're correct, I don't know those. But on other stats like childbirth deaths, the United States is much worse than Sweden. And I think ultimately, life expectancy kind of trumps that all. And whatever you want to say about our healthcare system is we spend way too much on it. And it's interesting that with the government approach to that, it's actually cut costs quite a bit. Without a libertarian approach, how would it actually reduce healthcare costs?
Well, I mean, a key part of that is the fact that when a large amount of the high costs of health care, specifically health insurance in America, is driven by government, mandated market distortions. For example, the fact that there's numerous states gold plate their insurance policies. That means that the insurance companies in the state have no choice. You have no choice when purchasing it either. They have to provide coverage for certain procedures. That raises the costs of insurance. Furthermore, you cannot purchase insurance across state lines. Therefore, there's no competition over policy. There's no real competition over policies. There's a tax bias towards employer purchase of health insurance that you cannot forget. There's a tax credit or deduction for businesses that provide health insurance to their employees. That same credit, that same bias does not exist towards individual purchase of health insurance. if that were corrected so that it was favored individual purchase of health insurance, the market would respond much more accordingly. I mean, if you look at car insurance, it's still expensive, but it's nowhere near comparatively. A key part of that is because companies have to compete over individual buyers. Therefore, plans are created tailored to individual needs rather than employer needs, which are very different. I mean, those are all factors into it. There's also things like the EMTLA, the requirement that hospitals have to treat someone regardless of what their ability to pay. That drives up costs when people choose, instead of using the hospital as a hospital, they go to the emergency room as their general practitioner. Once again, that reduces resources and raises costs, the cost of healthcare for everyone. And finally, there's also the issue of medical malpractice, which it is a danger. You do need ways to address it, but it's also a spiral massively out of control in terms of scope of what can be considered as medical malpractice. It also raises costs, the key part by requiring doctors to purchase very expensive malpractice insurance. A number of libertarian reforms would help remove these government mandated market distortions, lowering the price of insurance and healthcare.
Yes, I was to talk when we talk about states have different laws and different systems. And I would say health is not a state issue; it's a humanity issue, and that is the point of the Swedish ideology. It should not matter if you are born on this side here or this side here, or who parents you are, because you should be entitled to your health care, just because you are a human being. And that is the center of what we believe in. It's your right as a human being. And I just want to clarify as well, we have one of the best healthcare systems in the world. So I don't think we are slacking off, and I think we're doing very fine. But I would also say that I don't always say that state has to do everything. I would like to say that we have private practices. I welcome it. So you can choose whatever doctor you like. But I think the state should pay for it, if you understand what I'm saying. Should subsidize it. But I don't say the state should run everything. Actually, we can have private actors. People should be able to choose what doctor they want, but the state should stand for it. I just want to clarify that.
If the Socialists, Democrats, or Republicans would like to make a final statement, please do, and then we'll move on to the next topic.
Actually, what I would really like to agree with our friend at Lund University. It's really easy to talk about healthcare, talking about facts and figures, talking about, oh well, this will drive costs up. This is not cost effective. But you have to remember, these are people. These are people. These are Americans. These are human beings who have inalienable rights. One of which is to life, the most important. And that is why, if for no other reason, we should have universalized healthcare. Because these are people. These are fathers. These are mothers. These are sons and daughters. These are our friends and our family. And if we're not, and if they are left to the wolves of the public privatization and letting doctors decide who gets treated and insurance companies decide who gets treated, then what kind of humanity is that?
I would like to also agree with those notions. Obviously, government healthcare would be expensive. There do need to be reforms in the current healthcare system in the United States, as Dr. Fisher pointed out. It's extremely expensive right now, and that needs to be fixed. However, I do not believe that a total privatization of healthcare is the way to go. That could lead to numerous issues, the most important of which is that millions and millions of people will be left behind, not able to afford, or not covered by the particular insurance that's offered to them. I think that's the key point here, is that people might have insurance, but that insurance does not necessarily cover the needs that they have, depending on how much they pay, what insurance company they're with, etc. So that's the key point and key reason why there needs to be universal health care, so that we can cover everyone regardless of previous conditions or minute details, which currently many insurance companies say, oh well, you used to smoke, or you used to do this, or there's a tiny problem, and so we're not going to cover the costs that you need for this surgery, for anything. I mean, people get a flashlight stuck in their throat and it's $2,000 or something like that. It's outrageous. Things like that should not have to be paid for by individuals, especially those who go bankrupt because of these problems. That's a huge issue, is healthcare bankrupting.